Picture this. It's 2 a.m. in a small rural hospital in West Texas. A 52-year-old man comes into the emergency department with crushing chest pain, radiating down his left arm. He's diaphoretic, drenched in sweat. His wife is terrified. The nearest cardiologist is 90 miles away. The physician on call is managing 3 other critical patients. The transfer helicopter is grounded due to the weather. The EKG shows ST segment elevation. This is a STEMI, an ST elevation myocardial infarction or a heart attack. That means a major coronary artery is completely blocked and a heart muscle is actively dying. In a perfect world, this patient would be in a cardiac catheterization lab within 90 minutes, getting that blockage cleared. But there is no cath lab. There is no cardiologist in the building. There is no backup. So here's what happens. A critical care nurse, let's call her Christine, immediately recognizes the STEMI, activates the facility's chest pain protocol, starts dual antiplatelet therapy, administers morphine for pain control, and begins coordinating with a distant cardiologist via telemedicine. She's calculating medication drips, monitoring for life-threatening arrhythmias, managing the patient's anxiety, and simultaneously preparing him for a high-risk transfer the moment the weather clears. She's also doing something most people don't realize is part of critical care nursing. She's running a mental decision tree. If he goes into VFib, what's my code protocol with limited staff? If the weather doesn't clear in the next hour, do I push for thrombolytics even though the risk of bleeding is higher? If his blood pressure drops, what's my vasopressor strategy with no ICU backup? Christine isn't just following orders, she's anticipating, adapting, and leading in a system that was never designed to support her. But depends on her entirely. That patient survived, not because of the proximity to advanced technology, but because a nurse with critical care expertise knew how to manage a life-threatening emergency with limited resources, no backup, and the clock ticking against her. Now, let's shift that scene. It's no longer a rural hospital in West Texas. It's 254 miles above the Earth. A crew member on the International Space Station experiences acute chest pain. There's one physician on board, but they're in the middle of a critical research protocol. The next resupply mission isn't for another 6 weeks. Ground support is minutes away by communication, but hours away by any tangible help. The same questions apply. Who's running that mental decision tree? Who's anticipating complications? Who's managing the psychological and physiological crisis simultaneously? Who's coordinating with ground control while keeping the crew calm and functional? Here's the thing right now. NASA's answer is the one doctor. But anyone who understands healthcare delivery knows that model doesn't scale. It didn't work in rural America, and it won't work 250 miles above it. What if the future of space exploration depends not on more rockets, but on recognizing that nurses, critical care nurses, emergency nurses, advanced practice nurses are the missing variable in the equation? What if the skills that Christine honed in that rural ICU, the ability to manage high-stakes emergencies with limited resources, to think 10 steps ahead, to lead in chaos, are exactly what's needed to keep humans alive in space? And what if the biggest barrier isn't technology or funding, but the fact that nurses aren't even in the room when these systems are being designed? Let's talk about it. If you're new here, welcome to the Melanin Initiative. I'm Dr. Kimberly Madison and one of your co-hosts here. I'm a doctorally prepared nurse practitioner and the founder, along with Alicia and Geraldine, who send their love in their absence. We're health literacy. When we say health literacy, we're talking about your ability to obtain information, to understand that information, and then to use it, to manage your health and advocate for others. We have 2 missions here. The first is to promote that health literacy, both amongst the public and our peers. The second is to elevate the expertise of nurses, to bring awareness to all the diverse career opportunities in the industry, and to let all of our peers know how they can leverage their expertise, both as clinicians and entrepreneurs. If you haven't already, this is your chance to subscribe. Leave us a thumbs up, put a comment or 2 in the comments, give us a 5-star rating on the Apple and Spotify podcast. Every time you interact with our platform like that, it shows the algorithm that this information is important, so that when people like you look for topics like this, we'll show up higher in the search results. Remember, this show is for educational purposes only. The opinions expressed here are opinions alone. They are not a representation of any of our affiliations. If you think you might be experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. If you think you might be having a physical emergency, you should call 911. If you or someone you know might be having a mental health emergency, you should call You can call 988 or text 741-741. So today's guest isn't someone you'd expect to find advocating for space medicine. She didn't grow up dreaming of astronauts or staring at the stars. She grew up understanding what it means to work in healthcare systems that are stretched thin. You learn to make miracles happen with duct tape and determination. Christine Ricon is a master's prepared critical care nurse with a CCRN certification, credentials that tell you she's seen some of the most high stakes life or death situations healthcare has to offer. But her story isn't just about working in ICUs, it's about what happens when you take the critical care expertise and deploy it in one of the most challenging, under-resourced environments in the American healthcare system, rural medicine. Christine has written about the systemic challenges facing rural nurses, the kind of burnout that comes not from a lack of passion, but from being asked to do the impossible with no support. She's lived the reality of being the most qualified person in the room, managing complex patients with limited resources, and doing it all while navigating healthcare silos that were never designed with nurses' expertise in mind. And here's where her story gets interesting. Christine started asking a question that very few people in healthcare are asking. She looked at the skills she was using every single day in rural critical care: adaptability, resourcefulness, holistic patient management, crisis leadership, and she realized something. These are the exact skills needed for space medicine. But when she looked at who was designing space health policy, who was being invited to the table to plan for long-duration missions and commercial space travel, she saw a glaring absence: nurses. Christine isn't waiting for an invitation, she's building the path herself. And today, she's here to talk about why diversity in space medicine matters, how to overcome healthcare silos, and why the future of keeping humans alive in space depends on nurses claiming our seat at the table. Not later, but now. Christine Ricon, welcome to the Melanin Initiative.
Hi, thank you for having me.
Yeah, it's so wonderful to have you. Hopefully we set up the reason why you're here. Did that relate? Is that something you could relate to?
Yes, it really is. And just like you said, working in rural medicine right now, there's a lot of parallels between space and rural medicine. So I think, like you said, that's where I realized that, hey, why aren't we in this conversation? So that was actually really good. Thank you.
Yeah, so before we get into our case study and learn more about why you're here, we like to get to know our guests a little more personally. We have our 5 questions in 5 minutes. This is the fun, easy part of the show. No overthinking, okay?
Okay.
So the first question is, what's one song that perfectly captures your approach to nursing?
One song that captures my approach to nursing. That's a really good question. Um, let's see. I'm overthinking it.
That's those quick assessment skills.
I know. My gosh. I I take like a really positive outlook to nursing. So it's gonna be a really happy song, probably something like "Walking on Sunshine" or something like that.
I love it. Okay, if you could have dinner with one person, living or dead, who has shaped the future of healthcare and space exploration, who would it be and why?
Um, I actually um, would like to have dinner with Dr. Leonhardt. He is actually a really prominent space medicine physician. He's actually very nice, and he responded to a couple of my LinkedIn cold messages. So I actually would really like to have dinner with him.
What's one thing you learned about communication that you didn't appreciate when you were younger?
Communication is key. I think, especially in medicine, in the ICU, you're dealing with people at their worst times. So I didn't know how important it is to literally communicate everything. A lot of the fear in patients comes from the unknown. So for me, my big thing was, trying to understand what they know and if there's any gaps that I could fill. And it really does give them a sense of calm just knowing. Even if what's coming up may not be something to be excited about, but just knowing what's going to happen and what might happen has been it's really helpful for them. So I think for me, communication, just the fact that you just keep communicating is number one.
So I mentioned that you have your background in critical care. And I know when I started nursing, even literally my first week in the hospital as a nursing student, I was in the ICU. And the first week, I realized right away, then I had already had a passion for, they already had elevated ICU and it's like a wonderful place. But the biggest surprise to me was how much death was happening that week. Given your time in the ICU, what's been your biggest surprise there?
Um, I was mostly in a trauma ICU, and there is a lot of death in the trauma ICU in particular, and it can be pretty rough because it's there's a lot of uh, people that aren't as you say, like they're younger people, and they go into some trauma, and maybe they don't expect people don't expect that they're going to pass or anything like that. So I think one of the biggest surprises that I've learned is that not only is your patient are you dealing with the patient, but you're also comforting and dealing with the family members. So you really have like two sets of patients, really. And to me, they don't teach you that in nursing school, or at least they tell you like a little bit, like you have to communicate. But the fact that you really have to like truly care for the family as well was a big surprise.
Yeah. Yeah, it's a huge one. And then the last one, my favorite question that we ask all our guests, what season are you in now?
I am in like my third growth season. Like I am always kind of like changing who I am. And I feel like this is another season of like another step of in the ladder of who I am and who I want to be. So I feel like I'm in like my third growth season in my life.
Wonderful. And I imagine what we're going to talk about today is part of that transition.
Definitely, definitely.
So let's go back to our opening story. You worked in rural critical care, which a lot of people don't realize is one of the most resource limited, high stakes environments in our industry. How did that experience shape the way you think about space medicine?
I think for me, in where I work in particular, they do have a lot of technology, but what they don't have as much is the staff, right? So it's limited in the amount of people that you have, and also limited in the expertise of the people that you have. So usually the people that work in like rural hospitals are the people that live around there. And in rural hospitals, to me, it's more challenging because there's a lot of lull, right? So you have a lot of your usual, patients, but then you'll have a patient that will come out of nowhere and it'll really test your skills. So for me, the thing that I've learned is that you always have to be ready, because you never know when in the middle of your shift there might be like a mass casualty outside and they can't bring them to different hospitals. So you have to be the one to deal with it, and also help the nurses that work there that aren't at like a certain expertise level to manage it. So you're managing the patient and you're managing kind of like the staff as well.
Mm. So for our audience, would you describe space medicine?
Well, space medicine in particular is the study of how space flight affects the body. So we have aerospace medicine, which is how altitude affects the body, and that's pretty well studied. But space medicine takes it further past like the Kármán line, which is essentially the line where space starts. And it is how not having the 1G of Earth's gravity pulling down on everything. So a lot of people would be surprised to know our bodies are made for our specific gravity, right? So anything less than that for a long period of time, the body kind of doesn't know what to do with it. So space medicine really is a specialty, kind of like how pediatrics is, where there's pediatric everything, pediatric neuro, pediatric psych, pediatric everything. There's space medicine everything, because microgravity literally affects every single part of the body. Every single organ is affected, every single, your skin, your hair, your eyes, everything is affected. So, and the interesting thing about space medicine is not only is it medicine, but it's also how people interact with machines. It also has a piece of psychology in it because of uh, isolation. They worry about isolation and being far away from your family for a long time, and also a little bit of engineering with the whole how we interact with machines. So really, it encompasses a lot.
And that microgravity that you spoke to, can you just explain how you would describe that to your daughter?
Sure. So microgravity. So we live on Earth and we experience 1 g of gravity. And like I said, that's the force pulling you down to the Earth. Once you go higher up, the more higher you go, the less atmosphere there is, and um, the less of that weight that you feel, right? So essentially, what a lot of people have like a misconception that when you're in space, you're floating because there's no gravity, but really you're constantly falling. So that constantly falling feeling is where the like floating comes from. Um, and that floating makes the fluids in your body do things that aren't that don't usually happen. um and just to go into a couple of the things, I mean, your a lot of your fluids are used to going down into your body and then having to be pumped back up. But in space, the fluid from your legs likes to sit in your trunk, right? So now you have more blood in your chest and in your head, which is why a lot of the astronauts look like this, because all of their fluids are up here. And that affects your eyes because it pushes on the retina. It changes the shape of the eye from a ball to like a kind of like, it flattens them. Um, it makes your brain think that your blood pressure is higher than it actually is. So you start getting rid of fluid because your brain is like, well, I have all of this fluid, not knowing that it's because everything is being pushed up there, right? It just thinks that maybe you're drinking more or something. So you're diuresing, or you're urinating out more fluid, not but you are essentially now dehydrating yourself because you're not really full of fluid. Your fluid is just shifted up. It's just it's just everything changes.
Now you're starting to talk nursing language. So speaking of nursing language, if you could just kind of paint the picture of a typical shift in rural critical care and what that actually means, and some of the challenges that you face there that we would be surprised to hear.
Well, yeah, definitely. A lot of times, in rural medicine, because there are not many hospitals around, right? We're kind of like the safety net. So, because I work in the ground transport for that hospital, and they don't have a lot of specialties, we end up having to take people that need anything from orthopedic procedures. You know, they fell and they hit their head and they're a little confused, and the CT scan shows something funny, but we don't have a neurologist or a neurosurgeon to do anything about it. We end up as the ground team taking them from that hospital out to another hospital. But because we're not always transporting people, we help a lot in the ER. And the flow of that ER is more like an urgent care, right? So people, especially in rural areas, a lot of people use the ER as primary care, just because of how difficult it is. The provider shortages out there. It's just easier to go in if you have a problem and get seen. So it's more like an urgent care. So it's easy to get complacent, right? But occasionally we do get the patient who we actually got a patient who, because we're in a farm, in a very large farm area, some of the people that work in the farms they get overheated. So we actually get really bad heat stroke patients. We had a guy come in 106 degrees, and that's like very scary. That's very deadly. So I think people would be surprised to learn that rural medicine is very challenging, not only because of the lower resources, but because the population out there is more chronically ill, and because sometimes out of nowhere you can get some really sick people come in.
Hi, I'm Alicia from the Melanin Initiative Podcast. Our mission is twofold. One, to simplify complex health information so you feel empowered to ask questions, educated on how to manage your health, and confident to navigate the healthcare system. And two, to elevate the expertise of nurses, spotlight the diverse career opportunities within the healthcare industry, and inform our peers how to leverage their expertise as clinicians and entrepreneurs. In less than 2 years, we've grown to over 50,000 views and 1,000 downloads, with an international audience spanning the US, Canada, the UK, Australia, and more. Our engaged listeners are professionals, entrepreneurs aged 25 to 44 who value authentic, impactful content. Want to connect with this dynamic audience? Advertise with us. Send in your 1-minute video ad and let's amplify your brand. Email tmi.melanin@gmail.com for rates and details. Let's work together.
How you describe the emergency department being utilized like urgent care and primary care, that's everywhere. And we've tried to describe that here on the show. Why we really want patients to have a primary care provider and utilize them, and how that overstresses our system. I don't know that message is really being clear because of the generations, right? Also, I mean, it's a very multi-layered, but we just can't emphasize enough how important it is not to use the ED like as a replacement for your doctor.
Definitely.
So just want to take a little commercial break for that. So what you described, there's no cardiologist, there's no urologist, neurologist. You're transporting patients. Where are you transporting them?
We have a few area hospitals that are kind of like level 2. We have 2 level 1 hospitals. So any trauma that we get, we'll go to one of the 2 level 1 trauma centers. But everybody else, for the most part, is going to the closest ER that we have, maybe like 20, 25 minutes away.
Oh, okay. That was my next question. And you're in Florida, for people who are wondering.
Yes.
And so you're a critical care nurse in the ICU, but you transport patients, and sometimes you're in the ED. Can you just kind of explain like what it is that you do and how you came to those decisions?
Yes. So my background is mostly ICU. So it's mostly my background that is trauma ICU. I've also been in the trauma resuscitation bay at a level 1 hospital. And then from there, I did a little education as well, with some associate level nurses. And then I did a little flight nursing. There's 2 different types of flight nursing. There's the rotor wing that's what everybody wants to do. So that's the helicopters. And then there's in Florida, because we are so close to so many like Caribbean countries, there's a lot of fixed wing, so jet engine flight nursing. And that's what I've done. So there's that. And then now I work as a critical care ground transport nurse / educator for the ground transport in a rural hospital in West Florida.
I could talk to you a whole hour just about those different flights that you just described. So many questions came out of that, because one of the things we do here is like to let people know all their options, and you just described like 5 of them.
I would love to be your critical care guy. You can have me back again if you want to talk about critical care only. We can talk about it now, whatever.
Yeah, we'll do it next time. But yeah, that was really, and actually at the time that we're filming this, we started a series called Becoming an ICU Nurse. And tomorrow I'm actually recording with the guest star of that series.
Nice.
Yeah, and so here's what I want to really dig into, because this is the core issue right now. When NASA SpaceX, Blue Origin, and other aerospace companies are designing medical protocols for space. You said we're spending more time in space, and it's not just astronauts. We know regular people are going out there, and that's expected to grow, right? So they're going out there for tourism. You told me about labs and the labs. Was it hotels?
Yeah, that's what they're
Hotels,
thinking. Yeah.
labs. And so when you say long time, you're saying if you're out there for a long time, you see all these effects in the body. What do you define as a long time?
So because one of the missions that they're thinking about after the moon, going back to the moon, is going to Mars. So when I say a long time, I mean 6+ months traveling to Mars, then another year or two probably on Mars, and then another 6+ months back. So that's like really what they're starting to consider long duration, because that's the longest we've been out in space. And then, over time, I mean, now we're talking about like really far away. Once they figure out the pesky problem of going the speed of light, which we can't do yet, they'll worry about interstellar travel, which is another beast. But for now, we're thinking long-term duration travel is probably Mars.
So right now, when they're designing these medical protocols, or really any policy, right? Who's in the room?
So right now, space medicine is mostly focused on peak performance. So it's astronauts, it's fighter pilots. They are like the top of, peak human endurance. They're screening out of 8,000 people. They're whittling it down to like 10 people, right? So these are like really like high level. So for now, they have the people that are making these medical decisions are flight surgeons. So these are doctors that do extra residencies in aerospace to become flight surgeons, and they really are the ones that are leading the charge in creating the protocols and creating all of the guidelines, which for right now is fine because the International Space Station is not far. It takes maybe like, depending on the capsule that's going up there, it takes anywhere from 4 hours to like 16 hours to get over there. If something happens, they'll be back down, right? It's not a big deal right now. It's maybe like 8 minutes or something like that to be able to make a call up there and back. So right now, this small, like kind of like skeleton medical crew, of one flight surgeon that's probably up there, and then another one that's available, maybe a few aerospace physiologists, which are essentially like military personnel. It's fine for now. But I think the most important thing is, if you're going to start planning for the future, you have to start including, anywhere that medicine goes, nurses will always follow that. So it just makes sense to have nurses as part of the conversation, because we really are the person that looks at the patient holistically. And I think that it's important that our voices are heard so that we can start considering people that maybe aren't as high peak performance. Since they're starting to do those, launches with the celebrities and things like that, eventually more and more what we call like regular people are going to be going up there. So it's very important that we create those guidelines ahead of time, and so that we're not scrambling.
And that's the way a nurse thinks, right? That's part of once we get past our phase of in our training and when we start working clinically, we're very task driven. There's 100 boxes to check. We're going to check all 100. Everything else, I don't really have the perspective yet. But once I build that muscle memory and I check off those 100 boxes with my eyes closed, now my critical thinking, my clinical judgment, it's on fire, right? That's what people are really paying for, that expertise. And
absolutely
ahead, that's what we do. So I have you right now, your blood pressure is fine now, but I know you're about to take this medicine, you're going to go have this procedure, you're going to walk for the first time. I'm already thinking what's going to happen in the next 20 minutes, in the next 12 hours, and in the next 3 days.
Absolutely. And because nurses aren't part of the conversation, one of the big pushes that are happening right now is creating AI clinical decision machines, clinical decision models, which which is okay. But being somebody that works with EMS and kind of like in an EMS capacity, I know that there is no amount of protocols that you can create that will be enough for every single situation that you're going to meet. I don't care how big your protocol book is. I don't care how smart your machine is. You need somebody that can see that protocol and think, okay, I know the protocol, but I need to deviate from it right now because this patient, and that's when you use your critical care thinking. So I think one of the roles, and I have like many ideas for roles that nurses could fit because we're just so versatile. One of the roles that a nurse could fit is, all our informatics nurses that love, computers. They can literally help, and there's a lot of nurses that are doing that. They can literally help adapt that AI, if that's what they want, and or have a critical care nurse or some kind of a CRNA that is, fully critical care that can be up there and be the one that does the medical management instead of creating a protocol and then teaching non-medical people how to put in an IV. It's just you have a global workforce of 28 million people that you're not even thinking about that you could utilize that love space.
Yeah, no, and we love problem solving. That's the thing I talk about. We're problem solvers, right? And so you
Absolutely.
mentioned the skeleton crew before, right? And look, like I said in our mission, we're here to bring awareness to all the diverse career options. And we know that there's people who write the orders, and then there's people who carry out those orders. And they're with that patient the entirety of their stay, every single minute. They're part of that. And so we know that healthcare is a team sport. And historically, when nurses are excluded from the planning phase, you've described what happens, right? Things get missed. And there's a lot of workarounds. You spend all this time designing a device, a protocol, a whole care model. And then you're having people implement it, and they're doing making all these edits and modifications because we weren't brought in at the ideation phase. We could have made this cheaper, faster, more efficient, and more user-friendly for the people that you have intended for it to actually help. And so for our listeners, you might be thinking, okay, but what does this have to do with me? Here's why this matters. Whether you're a nurse in a rural hospital, an NP building your own practice, or someone interested in non-traditional nursing careers, this is about pattern recognition. Every time a new field emerges, whether it's telemedicine, cosmetics, or space medicine, there's a window of opportunity. And if nurses don't show up early and demand a seat at the table, or build your own table, we get locked out of the policy, the design, and the leadership roles. Then 10 years later, we're fighting for recognition in a system that was built without us. Christine, what do you think needs to happen for nurses to claim that seat at the table in space medicine?
I think that we need to first get together. So I think number one is just to see just how many nurses are interested in this.
I already hear them. I already hear them all saying, sign me up.
Sign me up. Exactly. So once we all get together and we start to share, so that's one of the things that why I created the Space Nurse, is to be able to have like a central hub where everybody can go to, because I, for a long time, had to sift through all of the opportunities that weren't for me until I found like little targeted things. And some of these targeted things are not obviously space medicine, right? So, for example, there is a group in Penn Nursing that is very focused on nursing innovation, right?
Yes.
And at first you're like, nursing innovation, what does that have to do? But a lot of space medicine right now is solving problems. So one of the projects that I did with the NASA, like the space program, which is like a proposal building opportunity, which was really good, and I suggest everybody to do that. Was trying to create a technology to solve a problem that NASA has. And the technology that I created along with my group was an idea for a technology was, because medicine in space degrades faster than usual medicine down on earth, first they had to figure out why, right? And when they looked into it, they realized that the problem was that they're taking medicine out of their bottles. So you're taking Tylenol out of its original packaging and you're putting it into another bag, right? You're sealing it and you're putting it in a box full of bags full of bags of medicine, and you're labeling it and all that stuff. So the main problem is taking them out of their package and putting them somewhere else, right? But we have to take them out of this package to make it smaller so that it fits, right? Because right now we cannot bring a lot of things to space. So our idea was to use the technology that they use to seal potato chips, and create baggies, but filled with nitrogen and sealed, to make the medications last longer. And there's like reasons why we use nitrogen and things like that. But nursing innovation is a big skill if we're thinking about space medicine, because these are the things that you're going to be doing. You're going to be, how do we fix this problem? What technology can I use? What process can I improve? A lot of quality improvement. So I learned that just from looking myself. But, if we get together, I can tell people, hey, if you're interested in this, maybe you should look at nursing innovation. If you're interested in this, maybe you should get a little bit of extra training in telehealth. If you really like going outside, maybe you should focus on what is the word? Oh, remote medicine, right? Because there's wilderness medicine out there. There's literally a certification for wilderness medicine. And being out in the wilderness is a very low resource area, which will mirror being out in space, which is an extremely low resource area. So there's so many things you could do that I had to kind of figure out by myself, that now maybe you guys don't have to figure out anymore, because we're all together and hopefully we can lead each other.
I love that. And these are great opportunities for our graduate students who need ideas for their doctoral research. You just listed a whole bunch of opportunities. So I just want to recap for our audience as we're talking. We've already identified that the skills nurses are using in rural and critical care are adaptability, resourcefulness, and you mentioned it, holistic patient management, looking at the whole patient, not just your disease, not just the pain that you came in with, are the exact skills needed for long duration space missions, which are the future, and the future is now. If you can manage a critical care patient with limited resources on Earth, you can do it 250 miles above. We're speaking to our nursing friends, right? Also, we've identified nurses must show up early in emerging fields to influence policy and design, not just the execution. We're more than the worker bee. If we wait for an invitation, we'll be locked out of leadership. Space medicine is happening now, and we have the space nurse with us, and she's opened the window of opportunity for us. Now, I love talking about diversity in medicine, and you're here to teach us why diversity in space medicine matters, right? Because it's not just nice to have, it's mission critical. You've written about healthcare silos and systemic challenges. How does diversity, or the lack of it, show up in space medicine conversations?
I think it is a really big one in multiple ways. So not just like the obvious, like, and this is a big deal in STEM in general, right? So STEM in general is very homogenous, right? It's
You just tell what STEM is.
Yeah. I'm sorry. STEM, science, technology, engineering, and math.
And you mentioned innovation. We could not have a conversation about nursing innovation and not mention Rebecca Love. She is the nurse innovator. And what did you just say? STEM. She's on a mission to get nursing added to STEM. I just want to put that out there.
Absolutely. Oh, by the way, Rebecca Love, add me on LinkedIn. I'm waiting. I sent you a message.
She'll respond. And actually, I know there's other people also trying to make it STEAM. So we want to recognize all those initiatives that are out there.
I have also heard STEAM, where they add art into it, which is very important. Art is very important in there. So yeah, definitely. Where would the nurse fit in?
And this is important because there's funding and special programs and policies for those fields that nurses don't have current access to. And that's why we're saying nurses should be included so that we can get access to those funding opportunities as well. Funding means money. Right? We want access to that money too. Sorry to interrupt.
No, it's fine. Definitely, yeah. It's a very homogenous field. It's usually a man of a certain age, of a certain color that just dominates this field, right? So uh, I think it's very important because, if people don't see themselves, they're not going to feel like they even belong there. And on a different note, me being a nurse, I also felt like I didn't belong there at first. But let me dispel this myth right now, because I've never been in a more welcoming environment. I think one of the great things that I liked about space medicine is people in this kind of like environment, because they're pushing the envelope and they just want to go further and they want to see what's next. They are willing, and these are like really smart people. They understand that they need diverse voices, right? So I'm walking in here and I'm like, "Huh, thank you for letting me in. I'm just the nurse," right? And they're like, no, thank you for coming. Like, you have critical care background. We need that. Like, I need to talk to you. In fact, I'm doing a study on pulmonary emboli, and I have all this stuff for it, but I don't really know. So it's very welcoming. It's extremely welcoming. So I think that it's anybody that's worried about going in and belonging, right? I don't think that they need to worry, because it's very people only care about the result. And if I don't have somebody with a certain expertise and I need them, I'm going to welcome them when they come. So that, I think that's one of the biggest things that I noticed. There are a couple of space medicine kind of influencers that I follow, and one of them is a Canadian woman, ER physician, who's like big in space medicine. She's actually going to fly next year with Virgin Galactic, and she's Canadian, but she's of like Indian descent. So it's really good to see somebody at such a high level that's like my same color.
Yeah, and this is so important because if we're being honest, right, you mentioned it, the current model of space medicine was designed for a very specific population too, right? Military test pilots, mostly men, mostly white. And as we move forward, commercial space travel and longer missions with more diverse crews, we can't use one size fits all approach. If you're listening and if you've ever felt like the healthcare system wasn't designed with you in mind either, whether that's because of your race, your gender, your body type, your health history, your language, you already understand why this matters. Christine, what would it look like if nurses, especially nurses from underrepresented backgrounds, were leading the design of space health systems from the start?
I think we would definitely have a more inclusive, uh, we would have more inclusive guidelines. I think because, like we said earlier, it's a man of a certain age that's, a certain color. We have a lot of things only made for that person. So we have spacesuits that are for people of a certain height, that are of a certain build, and most people are not that. So we find that spacesuits are not fitting people. They're too tall for them. They have to like make adjustments. So there's a big push now to create spacesuits that are more friendly for women, for shorter people, for taller people, for bigger people. So I think if nurses were part of that, because we are usually so focused on the patient, that would be obvious to us. Like, we need to make something for everybody. Like, why would we need to make something that's more tailored, something that can become smaller, I think also because nurses are so problem solving oriented, we really would complement well with scientists and engineers.
Who may have a nursing background, by the way.
Exactly. Exactly.
Myself.
So I think that we would just fit perfectly.
Yeah.
And that's why me especially was so surprised that we aren't already here.
Well, we're here now. We just took off
Yeah.
40 minutes ago with the space nurse. And what you just described was actually another wonderful argument for why we should be part of this team. You
That's right.
literally just gave examples of that in your answer. And you also give a wonderful description of our advocacy role. You said it would already be obvious to the nurse that this should happen, right? And this is why
Absolutely.
diversity in space medicine is not optional. It's operationally essential. As space missions include more diverse crews and commercial travelers, I love that whole space tourism, even if you don't care about the research or all the things Christine's mentioned about saving lives. What about
Absolutely.
tourism? People love that one, right? Nursing expertise, it's holistic. Patient-centered care will be the difference between success and catastrophic gaps in care. So as we wrap up our powerful conversation, let's bring this home for our listeners. If someone's listening right now, and if you are only listening, I just want you to pop on over to YouTube or LinkedIn so you can see our outfits. We came ready for the mission.
That's right.
So if someone's listening right now, maybe they're a critical care nurse, and we know they might be feeling burnt out in a rural hospital or practically anywhere in the healthcare system. Maybe they're an NP building a practice and wondering what's next. Maybe they're a nursing student who just got told you can't do that. Or maybe this is a parent or a counselor giving advice, right? And they need to expand and be exposed to more things so they can give better advice about jobs of the future. What do you want them to know?
I want them to know really a couple of things. So I think everybody's first instinct, and also I didn't help with all of the things that I was saying, is that it's all research, but there's so much. I feel like nurses can fit in a lot of places. So I feel like I feel like nurse practitioners can be helpful in pre and post flight care. So getting them ready for to go and rehabbing with them when they come back. I think, like I said, informatics nurses can help inform the AI. I think there are a lot of nurse leaders out there that can help kind of figure out a lot of the planning stages. There's a lot of like project management when it comes to like mission preparedness. So I think that that's important. And also in policy, like there's a lot of nurses that are interested in policy, and they can definitely advocate for like a global equity for nurses to be part of space medicine, not just here, but everywhere. I think one of the big things that I want them to know is that this industry is very welcoming right now. We're kind of like, I say we, but like we're it's kind of like not really in the infancy phase, but we're really like looking forward, and people just want other smart people around them. So they are very happy to see you. They're very happy to have you. There are other nurses stepping up. I have some friends that I talk to still there are other nurses that are excited. And my friend Dr. Joannes, he made his own VR aerospace medicine kind of like simulation training company. So shout out to him. We contribute in research. I think anybody that doesn't want to do research, there's other things out there. There's analog astronaut, which is essentially you being the person that volunteers to go into a space-like atmosphere, right? And a lot of people that want to be an astronaut, but aren't people that want to be an astronaut, but right now, of course, there aren't that many opportunities to be an astronaut. But people that want to be an astronaut eventually, they love analog astronaut, where you get to go and be away from your kids for like 2 weeks and just shut yourself in and be part of some studies that they do, usually in isolation. There's so much that we can do. And I think that once nurses realize that, and once the industry realizes that, it's all up from here for us.
No pun intended. Can you just explain the analog one? Because I think you said you didn't have to be a nurse for that, right?
No, so that's not necessarily like a nurse thing. Analog astronaut is, but there are a lot of nurses that would do it, but it's not something that you need to be a nurse to do. But analog astronaut is essentially where there are a lot of institutions, and usually it's NASA. It's a lot of universities that are studying space medicine. They will have their own habitat, right? And the habitat was made to look like Mars. right? So there's one university that has a habitat in the desert, right, to simulate Mars. Um, and you really do go in there. They seal everything just like if you were going to space. Um, you are in the room. If you want to get out, you have to put a suit on and open the airlock and all that. And there's studies that they do in those habitats, but they need people to actually volunteer to go in there. And usually in those habitats, they have some kind of a hierarchy of like commanders, or like there's somebody that's the leader, and then there's somebody that's in charge of medical, and there's somebody that's in charge. So it's another thing that, not just because you're a nurse, but that you can do in space medicine,
Right
if
now.
you don't want to just write and do research.
And I want
Right
to
now, yes.
I want to add two more. Media. Hello, we're right here. Things are happening. Someone's got to report it. Nurses,
That's right.
we're masters at communication, and especially being the liaison in that communication between all these disconnected components. And then fashion. That's a wonderful one. I kind of joked about it before we started recording, but then you brought it up. And so fashion is another thing you can do right now too. I wouldn't have even thought of that.
And there was actually somebody that went up in a flight, and I don't remember which one it was, but she actually went up there in like a dress, and like one of those dresses that have like the long tails, and did a photo shoot up there. So they're incorporating fashion, they're incorporating art, like there's like journalism, communication, there's everything.
You got us with the photo shoot.
Yeah.
That's that whole tourism, right? There's the people who care about sustaining life, and then there's just the people who care about taking the picture.
Absolutely. This looks cool.
And then there's competencies, right? If we're going to be out there having to perform at a certain level, we need someone developing our competencies and our continuing education so that we can do that at a very high level.
Absolutely.
And then we've talked so much about your background in rural critical care, your expertise when it comes to space medicine. I just want to spend a few minutes before we close out. You're an NP student, right?
Ooh, I am.
Psychiatric mental health nurse practitioner student, and you talked about isolation. And this is another area where nurses can show up. Can you just talk to us a little bit about mental health and space medicine and where nurses can play a role?
Sure. Mental health in space medicine right now is one of the big glaring issues. So if you go to NASA's like health, there's like a pipeline of like pain points that they have. One of them is isolation. So like radiation is up there, and like bone loss is up there, but then mental health is really high, because the farther we go, the longer that it's going to be you and 5 other people in a tin can, right? And I don't know about you, but after a certain time, people start getting annoying to me, and they have actually seen in analog environments and simulated long-term space travel where people will actually like get so angry that they like fight, because it's too long with the same people. And if we're going to go farther and farther, this is something that we have to fix. One of the main issues that I read about is that those high peak performing people, the astronauts with the right stuff, they call them, right? Because you made it this far. They tend to not report their problems, right? Mm-hmm. So if they're up there and they're feeling depressed, they don't say, I'm feeling sad today. They say, I feel really tired today, right? So they will express themselves in their symptoms. Okay. Not only that, but they're also afraid that if they say something, you're going to take their flight abilities away. Like next time we come up here, you're not coming. So I think there's a big push in mental health for long-term space travel, just because of that fact. If we want to go really far, we literally need to figure out what composition of team is the best to be able to, for everybody to get along. What trainings do we need to teach them? What hierarchy? Me and my sister, who's a therapist, we actually kind of we are writing something and doing some research about what is the appropriate team hierarchy. So the old way was one commander who was the boss, and everything that they said goes, right? But that perpetuates a lot of resentment and a lot of anger, which makes things worse. So again, it's just the farther we go, the more important that mental health becomes. And having the ability to make one phone call every day to one person at mission control is not enough.
Simply put, I like that. 3 takeaways for our audience if they remember anything from our conversation today.
3 takeaways. I think that you guys, it's very important that you guys know that the people in space medicine want you here. They want your input. That's number 1. I think that we need more diverse voices. We need more women. We need women of color. We need men of color. We just need more different types of voices. There's even people with disabilities that are able to go up there now. So like we just need we need different voices to be able to make sure that space is a place that's welcoming to them. And I think that the last thing that I want to say is just that nurses belong there. It's just a natural fit. Wherever medicine goes, nurses follow. And if we want space to be truly inclusive, we need to be there right now, helping making those decisions.
And you're doing that for us, right? You're doing that for us, which is the work you've already done and that you're continuing to do. So what's the first step someone should take and how can they connect with you?
If you go to thespacenurse.com, you could sign up. You can put your email and sign up, and I'll send you the Space Nursing Guide 101. And that will kind of get your feet wet as far as like, okay, this is an organization I should join. This is a class I could take. And a lot of those things that I put are free. So these are things that you can do now, just to kind of understand space medicine and see if that's something that you're even interested in, and even kind of figure out what your niche would be in that. So I think that would be number 1. Follow me on Instagram, _space nurse. _space nurse. I'm going to be posting there more regularly. And yeah, I will see you on thespacenurse.com, and I will send you a newsletter weekly.
Wonderful. And those who do sign up to be your newsletter, they'll be the first ones to be notified when your course is ready too, right?
Absolutely. That's right. I want to create a course that will help identify your niche in space medicine. So it will kind of be an introduction to space medicine 1, and then what can nurses do? And every segment of the course will be a different thing, a different thing that a nurse could do, and just take you through what are the options for you. So yes, definitely, I'm going to do a space course, and I want to work with some people to be able to make an actual nursing curriculum, because one of the things that I looked up was that it's quite possibly, if because I know a lot of these companies are worried about the bottom line, right? It's quite possibly less expensive to take a nurse and teach them focused engineering principles than to take an engineer and teach them nursing. Because you're going to have to take an engineer that has done all that school, and now they have to become a nurse, which is a whole nother set of training. So technically, it's more cost effective to do it this way. Hello, we're out here, 28 million.
Well, we thank you, Christine, and it's been a delight. We've learned so much. You fulfilled some of my own childhood dreams today, and we're just
I love your hat.
we're delighted to. Oh yes, we're delighted to see your career take off, pun intended. And we'll have all your links to your website below and your article. You're welcome back anytime. Everyone, remember, if you have any questions for us, You can email us your questions at tmi.melanin@gmail.com. If you haven't already, you still have time to comment, give us a thumbs up, and rate us and give us 5 stars on Apple and Spotify so that when you interact with our content like that, it shows the algorithm that this information is important so that when people like you look for topics like this, we'll show up higher in the search results. At the time of this recording, we release new episodes every Sunday on YouTube and LinkedIn at noon Eastern, and we drop the audio at 5 a.m. on your favorite podcast app so that our night shift friends can be the first to get something and not the last. We thank you all for watching. We'll
Yes.
see you next time.
Mission control. All systems are go. Astronaut, do you copy?
Copy.
Copy that, mission control. Loud and clear. Roger that. Prepare for liftoff in T-minus 15 seconds. Guidance is internal. 12, 11, 10 seconds and counting. 9, 8. Ignition sequence start. 5, 4, 3, 2, 1, 0. All engines running.